My mother died a cripple in a wheelchair at 51 with rheumatoid arthritis. She had severe arthritis. She was only 5 stone when she died, and her hands were all cramped up. Her knees were twice as wide as mine. Her feet, she could not walk anymore. Little by little by little, the arthritis had taken over her body. Imagine waking up one morning and your hands feel like they're on fire. You try to get out of bed, but your knees won't bend. You're only 30 or maybe 40 or even 50, and suddenly simple tasks like opening a jar or climbing stairs feel impossible. What if I told you this isn't just getting older? What if I told you it could be arthritis, a condition that's silently affecting over 54 million adults and 300,000 children right now? And what if I told you there are ways to fight back, to reclaim your life, and to stop the pain before it stops you? Stay with me, because what you're about to learn could change everything. Before we start, drop in the comments from where you are watching this video and what health topic you'd like to see in the next video. As a special thank you for joining us today, we're giving away 100 free copies of my best-selling book to subscribers. So, if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book. Let's talk about arthritis. It's one of those words we've all heard, but most of us don't really understand. Maybe you've brushed off that stiffness in your knees as just part of getting older, or maybe you've seen a loved one struggle to open a jar because their hands just won't cooperate. Whatever your experience, arthritis is more than just a few aches and pains. It's a complex, often misunderstood condition that affects millions of people worldwide. Today, we're diving deep into the signs, symptoms, and treatments of arthritis. By the end of this video, you'll not only understand what's happening inside your joints, but also what you can do about it. So let's get started. What is arthritis? First, let's break it down. What exactly is arthritis? The word itself comes from the Greek words arthro, meaning joint, and itis, meaning inflammation. So arthritis literally means inflammation of the joints. But it's not just one disease. It's an umbrella term for over 100 different conditions that affect your joints, the tissues around them, and even other connective tissues in your body. The most common types are osteoarthritis and rheumatoid arthritis, but we'll get into those in a minute. Here's the thing. Arthritis doesn't discriminate. It doesn't care if you're 25 or 75, if you're an athlete or a couch potato. It can sneak up on you slowly, or it can hit you like a freight train. And while it's true that the risk increases as you get older, arthritis isn't just a natural part of aging. It's a medical condition, and like any condition, it can be managed if you know what to look for and what to do about it. Signs and symptoms of arthritis. So let's start with the signs. How do you know if that ache in your knee or that stiffness in your fingers is actually arthritis? Well, there are a few key symptoms to watch out for. The most obvious one is pain, but not just any pain. This is a deep, aching pain that often gets worse with movement. It might start off mild, like a dull throb after a long day, but over time it can become constant and debilitating. Some people describe it as a burning or grinding sensation, especially when the joint is in use. Then there's stiffness, especially in the morning or after sitting for a long time. You might notice that your joints feel tight and hard to move, almost like they're rusted over. This stiffness can last for 30 minutes or more and often improves with gentle movement or as the day goes on. Swelling is another big one. Your joints might look puffy or feel warm to the touch. This happens because the inflammation in the joint causes fluid to build up, making the area appear larger than usual. In some cases, the swelling can be so severe that it limits your ability to move the joint at all. And finally, there's reduced range of motion. You might find it harder to bend your knee, lift your arm, or even grip a pen. Over time, the joint may feel like it's locking up, and you might hear or feel a crunching or cracking sound when you move it. This is often a sign that the cartilage has worn down and the bones are rubbing against each other. Types of arthritis: osteoarthritis versus rheumatoid arthritis. Now, Let's talk about the two most common types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is what most people think of when they hear the word arthritis. It's the wear and tear type where the cartilage that cushions your joints breaks down over time. Imagine your joints are like the hinges on a door. Over time, those hinges can get rusty and squeaky, and if you don't oil them, they'll start to grind and wear down. That's osteoarthritis. It usually affects weight-bearing joints like your knees, hips and spine, but it can also show up in your hands and fingers. Rheumatoid arthritis, on the other hand, is an autoimmune disease. This means your immune system, the thing that's supposed to protect you from germs, gets confused and starts attacking your own body. In this case, it attacks the lining of your joints, called the synovium. This causes inflammation, which leads to pain, swelling, and eventually joint damage. Unlike osteoarthritis, rheumatoid arthritis often affects the same joints on both sides of your body. So if your right wrist hurts, your left wrist probably does too. It can also cause fatigue, fever, and even problems with your heart, lungs, or eyes. Diagnosing arthritis, but here's where it gets tricky. Arthritis isn't always easy to diagnose. The symptoms can be vague and overlap with other conditions. You might think you just overdid it at the gym, or maybe you're just getting older. But if you're experiencing persistent joint pain, stiffness or swelling, it's worth talking to a doctor. They might do blood tests, x-rays, or even an MRI to get a clearer picture of what's going on. Treatment options for arthritis. Now let's talk about treatment, because here's the good news. While there's no cure for arthritis yet, there are plenty of ways to manage it and live a full, active life. The goal of treatment is to reduce pain, improve function, and slow down the progression of the disease. And the earlier you start, the better. Lifestyle changes can make a huge difference into the right step of healing. Exercise, for example, is one of the best things you can do for arthritis. I know it sounds counterintuitive. If your joints hurt, why would you want to move them? But regular low-impact exercise like walking, swimming or yoga can strengthen the muscles around your joints, improve flexibility and reduce pain. Just make sure to start slow and listen to your body. If something hurts, stop doing it. Exercise also helps with weight management, which is crucial because extra weight puts more stress on your joints, especially your knees and hips. Even losing a few pounds can make a big difference in reducing pain and improving mobility. Plus, physical activity releases endorphins, which are natural painkillers that can boost your mood and energy levels. Diet is another big one. While there's no magic arthritis diet, some foods can help reduce inflammation. Think fatty fish like salmon, nuts, seeds, and plenty of fruits and vegetables. On the flip side, processed foods, sugary drinks, and too much red meat can make inflammation worse. A diet rich in antioxidants, omega-3 fatty acids, and fibre can help fight inflammation and support overall joint health. For example, foods like blueberries, spinach, walnuts are packed with nutrients that can help reduce swelling and pain. And don't forget to stay hydrated. Water helps keep your joints lubricated and can reduce stiffness. Looking at food. So what are the most alkalizing foods? So we're going to make an alkaline list of foods and an acid list in foods. By looking at this acid-alkaline list, you can determine what is the best foods for arthritis and what are the worst. The most alkalizing is the humble lemon. And the lemon is acid where it should be and it's alkaline where it should be. Acid in the stomach to help you digest your meal. But when it's broken down in the gastrointestinal tract and the minerals are absorbed into the tissues, the minerals are an alkaline forming mineral. So this is the sodium and potassium and calcium and magnesium and iron. So the lemon is high in the alkalizing minerals. Dark green leafy vegetables. Dark green leafy vegetables are very alkalizing. We should be eating dark green leafy vegetables every day. Now let's dive deeper into the most effective natural foods that can help with arthritis. One, fatty fish. Salmon, mackerel, sardines and trout are packed with omega-3 fatty acids, which are known for their anti-inflammatory properties. Studies have shown that omega-3s can reduce joint stiffness and pain, especially in people with rheumatoid arthritis. If you're not a fan of fish, you can also get omega-3s from flax seeds, chia seeds and walnuts. Omega-3s work by blocking the production of inflammatory chemicals in your body, which can help reduce swelling and pain. Eating fatty fish at least twice a week is a great way to keep your joints healthy and flexible. Plus, it's a delicious and easy addition to your diet. 2, turmeric. This bright yellow spice contains a compound called curcumin, which has powerful anti-inflammatory and antioxidant effects. Research suggests that curcumin can help reduce pain and swelling in people with arthritis. You can add turmeric to your meals or take it as a supplement. Just make sure to pair it with black pepper, which helps your body absorb it better. Curcumin works by targeting multiple pathways in the body that contribute to inflammation, making it a powerful natural remedy for arthritis. Whether you sprinkle it on your food or drink it as a tea, turmeric is a simple way to add a boost of anti-inflammatory power to your day. 3, berries. Blueberries, strawberries, raspberries and blackberries are loaded with antioxidants which help fight inflammation. They're also low in calories and high in fibre, making them a great snack for anyone trying to manage their weight. Antioxidants in berries, like anthocyanins, help neutralise free radicals that can damage your joints and worsen inflammation. Adding a handful of berries to your breakfast or smoothie is an easy and tasty way to protect your joints and boost your overall health. 4, leafy greens. Spinach, kale and Swiss chard are rich in vitamins and minerals that support joint health. They're particularly high in vitamin K, which helps regulate calcium in your bones and cartilage. Plus, they're packed with antioxidants that can help reduce inflammation. Leafy greens also contain magnesium, which helps relax muscles and reduce stiffness in the joints. Whether you enjoy them in a salad, smoothie or sautéed dish, leafy greens are a versatile and nutrient-packed addition to your arthritis-friendly diet. 5, ginger. Ginger isn't just a spice, it's a natural powerhouse for fighting joint pain and arthritis. Packed with anti-inflammatory compounds like gingerol, it can help reduce swelling, ease stiffness and even improve mobility. Studies have shown that ginger works similarly to some anti-inflammatory drugs, but without the harsh side effects. Whether you add fresh ginger to your meals, brew it into tea or take it as a supplement, this humble root can be a game changer for managing arthritis pain naturally. You can even use ginger externally by creating a ginger paste or oil to massage directly onto sore joints for targeted relief. And one that's particularly helpful is the ginger poultice. Ginger is great for joints, especially inflamed joints. So what you do is you just grate that ginger very fine and you take a cloth, maybe you have a cloth this big, and you put the grated ginger into the middle area and then you fold it over. I call it east, west, north, south, and you make a little package. And when you've made your package, here's your package, and then you just have a little bit more plastic around it that covers it, or I should say it goes under it, and so it's applied to the wrist with the plastic over, and then it can be bandaged on. And we have found many people have testified that it draws the inflammation out of the skin to the point where it almost feels like the skin's burning, but it doesn't burn. So a ginger poultice, and that's excellent for painful joints. And remember, it is quite a powerful anti-inflammatory, has a powerful anti-inflammatory effect. The power of castor oil for arthritis. Now let's talk about castor oil. This natural remedy has been used for centuries to treat a variety of ailments, including arthritis. Castor oil contains ricinoleic acid, which has anti-inflammatory and pain-relieving properties. You can apply castor oil topically to your joints by massaging it into the skin, or you can take it orally in small doses. Some people even use castor oil packs, soaking a cloth in castor oil and placing it on the affected area to reduce pain and inflammation. Studies suggest that the ricinoleic acid in castor oil can penetrate deep into the tissues, helping to reduce swelling and improve mobility over time. Regular use of castor oil can also improve blood circulation to the affected area, which helps deliver nutrients and oxygen to the joints, promoting healing. It's a simple, natural remedy that can be a great addition to your arthritis management routine. I said you might like to just put castor oil compresses, and that's another one that can be used as castor oil. Castor oil doesn't have as dramatic effect as the ginger poultice, but castor oil can be used almost indefinitely. You could almost wear it 24/7. Castor oil penetrates very, very deep, and it can break up scar tissue. It can also break up calcifications, and sometimes with arthritis you've got calcified joints. Now, so we'll say calcifications because this is some of the cause for the pain in the joints. Essential vitamins for arthritis. Vitamins also play a crucial role in managing arthritis. One, vitamin D. Vitamin D is essential for bone health. It helps your body absorb calcium, which is necessary for strong bones and joints. Low levels of vitamin D have been linked to an increased risk of osteoarthritis and rheumatoid arthritis. You can get vitamin D from sunlight, fatty fish and fortified foods, or you can take a supplement if needed. Research shows that people with higher levels of vitamin D tend to have less joint pain and slower progression of arthritis. If you live in a place with limited sunlight, especially during winter months, a vitamin D supplement can be a game changer for your joint health. 2. Vitamin C. Vitamin C is a powerful antioxidant that helps protect your joints from damage caused by free radicals. It also plays a key role in collagen production, which is essential for healthy cartilage. You can find vitamin C in citrus fruits, strawberries, bell peppers and broccoli. Collagen is like the glue that holds your joints together, and without enough vitamin C, your body can't produce it effectively. This can lead to weaker cartilage and more joint pain. Adding vitamin C-rich foods to your diet is an easy way to support your joints. 3. By vitamin E. Vitamin E is another antioxidant that helps reduce inflammation and protect your joints from damage. You can get vitamin E from nuts, seeds and leafy greens. Studies have shown that vitamin E can help reduce pain and stiffness in people with arthritis, especially when combined with other anti-inflammatory nutrients. It's a simple addition to your diet that can make a big difference in how your joints feel. Physical therapy and assistive devices. Then there are things like physical therapy, which can teach you exercises and techniques to protect your joints and improve your mobility. Assistive devices like braces, splints or even shoe inserts can also help. And don't underestimate the power of heat and cold. A warm bath or heating pad can loosen up stiff joints, while an ice pack can reduce swelling and numb. So what's the takeaway here? Arthritis is a complex, often misunderstood condition that affects millions of people. But with the right knowledge and tools, it doesn't have to control your life. Whether you're dealing with osteoarthritis, rheumatoid arthritis or something else, there are steps you can take to reduce your pain, improve your mobility and protect your joints. And the sooner you start, the better off you'll be. If you have any questions or need further advice, please drop them in the comments below. Remember to like this video, subscribe to our channel for more valuable health tips. Thanks for watching, and remember, your joints are worth taking care of. See you next time, and as always, stay informed, stay healthy.